Welcome to the second video of our three-part series. The series is intended to introduce students and faculty to the concept of graphic medicine novels and how they can be incorporated into teaching and learning. Our second video is called Graphic Medicine: Benefits to Patients and Professionals. So what can graphic medicine do for you? These are just 5 of the high points I want to hit in our brief presentation. It helps prepare students, promotes empathy, provides accessible patient education, portrays accurate patient experience, and presents the roles of caregivers and family as well. Graphic novels can help students visualize what medical school and their careers may look like. These are panels from Level Up, The Lady Doctor, and The Bad Doctor. They all portray moments of frustration or insult, or in the case of the center panel, what happens when a patient catches you smoking behind the clinic. The authors of the article Hospice Comics write that illness happens not simply in a body, but also in a life. To provide relevant and effective care, the care must be contextualized in the life and community of the patient. Graphic pathographies can give doctors context and understanding they need to practice empathy. These panels from the book RX show the protagonist's internal experience of bipolar disorder, particularly the experience of being prescribed medication over and over without experiencing relief from her symptoms. It's a cycle that might otherwise be invisible to a treatment team. We already know that graphic novels increase comprehension and memory retention, but they also help patients process larger chunks of information over time. This is a panel from Trauma is Really Strange, a fantastic resource for anyone dealing with trauma in any context. Big topics are visible and accessible. Graphic novels can also help address topics that patients may not be comfortable discussing openly in a clinical setting. Sex is a Funny Word is a fantastic sex ed resource for both kids and caregivers with gender-neutral and LGBTQ inclusive language. It's age-appropriate and adorable. Pathographies written by patients and family members are intimate and brutally honest. This image is from Mom's Cancer. Treatment is portrayed as a tightrope walk with a vulture on one end of her balancing pole and crocodiles circling below. Whether a caregiver is the parent of a young child or the adult child of an aging parent, graphic medicine has the ability to prepare them for what that kind of work looks like, or to communicate the nature of that work to someone else. This panel is from The Mental Load. This image comes from Special Exits by Joyce Farmer. It's an unflinching look at her experience of becoming her parents' primary caregiver as they move into hospice and pass away. Here you'll find references for all the articles and books that I spoke about. I love giving recommendations, so please don't hesitate to reach out to us if you have questions. Thank you for watching. Here you'll find links to Japson's graphic collection as well as the different ways to get in touch with us if you have questions or comments. Please join us for the third video.